Hi, welcome. Let's go over pharmacology in asthma. In asthma, there are times when patient is in remission, meaning no active wheezing or trouble breathing. During this time, they still take medications which we call long-term controllers or maintenance medications because they prevent exacerbation of symptoms, keeping things under control. During acute attacks whereby they are exposed to a trigger and they have exacerbation of symptoms, they take acute control medications. Acute control meds are given to patients in acute asthma exacerbations or when the patient uses their flow meter, they blow into it and they fall in the yellow zone, that is below 80% of their personal best, or red zone, which is the less than 50% of the personal best. During acute asthma exacerbation, give rescue, fast-acting, quick relief medications. We always take bronchodilators first to open up the airway for other medications that will follow. First-line bronchodilators are the short-acting beta agonists, SABA. Note that SABA, for example, a good example of SABA is albuterol or levalbuterol. They can also be taken 15 to 30 minutes before exercise to open up the airways during exercise. In acute control, if need be, we can add an adjunctive, a short-acting anticholinergic or short-acting muscarinic agonist, SAMA. So SAMA and SABA, they are both bronchodilators, but SABA is the first priority, is the goal. We give it first, and if it's not working or is not working as well, we add SAMA. A good example of SAMA is the ipratropium. Then after that, bronchodilators, we give corticosteroids. They help with inflammation, reducing inflammation in the airway. We can give inhaled corticosteroids or systemic steroids if the symptoms are severe. Acute control meds are only given as needed. That means if a patient reports using the albuterol inhaler more than twice a week, it's a red flag. It means their asthma is not well controlled and the doctor needs to up their long-term control dose. For long-term asthma, long-term control means prevent asthma exacerbation or asthma symptoms, also called controllers or maintenance medication. They work very slowly, so we never give long-term controllers during acute attacks or acute exacerbations. They are taken daily. Even if the patient feels their personal best, they still have to take their long-term controllers, even if their flow meter reads green. Let's go over SABAs. SABAs are short-acting beta agonists. They are bronchodilators. Examples are albuterol, levalbuterol. They bind on the beta-2 receptors in the smooth muscles of the airway, causing bronchodilation. Do we use SABAs daily to control asthma? No. SABAs are only used as needed for sudden asthma attacks or exacerbations. If the patient is using SABAs more than twice a week, then they need to report to their provider because that asthma is not being well controlled. We can also use SABAs 15 to 30 minutes before exercise to prevent exercise-induced asthma. Because SABAs are beta agonists, they can also bind to beta 1 in the heart and can cause sympathetic effects like tachycardia. Those are some of the side effects: tachycardia, palpitations, shakiness, hypertension. So these symptoms are side effects, they're expected. So teach your patient to expect these side effects when they use their albuterol, feeling palpitations and shaky and all that. Another side effect of SABAs or albuterol is they can cause potassium to rush back into the cells and therefore cause hypokalemia. Albuterol can also cause hyperglycemia. A patient has been using albuterol. When should they call their doctor? They should call their doctor if they're using their SABA more than twice a week, or they use their flow meter and it falls in the yellow zone. They take their SABA and it's not working. They do not get a relief. They need to call their doctor. And when should they call 911 after using albuterol? Call 911 if they have a sudden chest pain. Remember, albuterol is a beta agonist. Like I said, it can bind on the beta 1 receptor in the heart, and it can also cause hypertension, which means the lumen of the arteries kind of narrows and especially for patients who already have maybe acute coronary disease, it can further narrow the lumen and the arteries and cause chest pain or STEMI or unstable angina. So they should also call 911 when they use their flow meter and it falls within the red zone. That means the exacerbation are about to get worse. They're about to get into a bad area or a dangerous zone. What about LABA? This is a long-acting beta agonist, never given in acute attacks, only used together with inhaled corticosteroids for long-term asthma control. Let's go over corticosteroids briefly. They help with inflammation in the airway and keep things under control. We have inhaled as well as systemic steroids. Inhaled steroids often used in long-term control with LABA. They can also be taken when the patient is they use their flow meter and they fall within the yellow zone, so they need to take a SABA and then follow it with an inhaled corticosteroid. Usually, inhaled corticosteroids are given as an inhaler, of course, and therefore can cause local side effects like thrush or hoarseness of the voice. The patient does not know how to use inhaler properly, or they do not know that they're supposed to rinse and spit after each use. Systemic steroids are given only during acute asthma attacks, especially status asthmaticus, never used long term due to the bad side effects of using systemic steroids. Very quick, what is the order we give relief inhalers during asthma exacerbation? We always start with bronchodilators, SABA, Albuterol. If it's not working as well, we can add in a SAMA, hypertropium, also helps with bronchodilation. And then we also have the steroids. You can give inhaled steroids if it's not as bad, maybe the patient is still in the yellow zone, and then systemic steroids if they're in the red zone or they're in status asthmaticus, if the asthma is severe. Key nursing responsibilities for SABA. SABAs are used only during acute control for rapid relief. Note that the patient will have some side effects like heart racing, tremors, shakiness. If the patient is using it more than twice a week, then that shows you that their asthma is poorly controlled. For inhaled corticosteroids, teach your patient to rinse their mouth and spit after using the inhaler. Monitor for oral thrush. For inhaled corticosteroids and LABA, that's long-term controllers, never use LABA by itself. It's always used together with an inhaled corticosteroids. Leukotriene modifiers, like Montelukast, one of the famous side effects is mood changes. And then systemic corticosteroids only use short term, so because of their systemic side effects. So you monitor for glucose, hyperglycemia, mood changes, infection, and if it's used long term, can also cause weakness in the bone and other things. Um, This is just extra for your own, if you want to look at it, it's the same thing we've gone over. So thank you for your support. If you have not subscribed, kindly do so. Like, share, and comment on my content. This will go a long way. You can also follow me on TikTok as well, NCLEX Prep 2.0. See you on the next one, and bye for now.